Hi, welcome back to my channel. It is Carrie the Chemist here. It's been a while since I've made any videos, but I am back with my series on sexually transmitted infections, and today's topic is genital warts. So, if you're new to my channel, welcome. And those of you who are familiar with my channel, thank you for sticking with me. Okay, so remember to like, subscribe, and continue to follow my channel. So today I'm going to do a little quote, and this is something that I started doing recently, and it says, life begins at the end of your comfort zone. Okay, all right, so let's begin, guys. So let's speak about genital warts. We're going to talk about what it is, what it looks like, how to treat it, and just go over like an introduction, general information about this sexually transmitted infection. So genital warts are they're the most common type of sexually transmitted infections, and statistics shows that 43 million people are infected with the human papilloma virus, which is what causes genital wart infection. Based on the statistics, it says that all sexually active couples will become infected with genital warts. So I guess that's why the statistics are showing such high numbers. So genital warts are caused by a virus. This virus is called the human papilloma virus, so call it HPV for short. Some strains of the HPV can cause genital warts, and others can cause cancers. So there are vaccines that can protect against certain strains of the genital warts, and the warts can grow on the vulva, they can grow on the walls of the vagina, they can grow on the anus, the cervix, and in men, it can appear on the tip of the penis, the shaft of the penis, the scrotum, the anus, and for people who practice oral sex, they can also catch genital warts, the virus, on the mouth and the throat. Let's talk about the signs and the symptoms. We kind of went over that, but let's talk about that some more. So the signs are these small flesh-like colored, they're brown, pink, they're bumps that are found on the genitals, so whether the vagina or the penis, and they can have this cauliflower look. If they're clustered together, they look like cauliflower shape. If the warts are close together, they look like cauliflower, and they can be itchy. Bleeding can occur if you get the spot irritated. It can cause bleeding during intercourse. So what are the risks of catching genital warts? Well, the risk increases by being infected if you have unprotected sex, if you're having another sexually transmitted infection. Usually if you're catching like gonorrhea, then you're exposed to other sexual transmitted infection like genital warts. So if you're doing unprotected sex, it just increases the risk of catching any STI generally. Using condoms can cover the warts for most part, but if the wart is not located in an area that is covered, then there is that contact, and then you can always catch the wart by contact. So using a condom is not 100%, so it's up to you to have that conversation with your partner to get tested for these STIs and to get treatment for it. That's the best way to deal with these situations. And if you're immunocompromised, that even increases your risk more if you're exposed to these viruses. What are the complications? Okay, some of the complications can be cancer. Certain types of HPV virus are associated with cancers of the vulva, of the anus, of the penis, of the mouth, the throat, and women should get regular pap tests or pap screening. And we know when we go to the gynecologist that they examine the cervix and send it to the lab to see if there are any unusual cells, and this is because they're testing for cancer or the presence of the human papilloma virus that can cause cancers. Warts can enlarge during pregnancy, and large warts on the vulva or the vagina can bleed when delivering a baby vaginally. So that's one of the other complications of the virus. So we spoke about prevention earlier, and we said to limit the number of sexual partners. Make sure everybody's been tested and you know what you're dealing with and get the proper treatment. Getting vaccinated to prevent genital warts is also something that's recommended. And there are 3 types of human papilloma virus vaccine approved in the United States. And there's Gardasil 9, and this is given to both male and females. Generally, you start giving it as young as age 9 and up to age 45 years. So the HPV vaccine can protect against cervical cancer, genital warts. Okay, diagnosis. Again, we spoke about pap smear, and this is usually done for women, so that the doctor will examine the cervix and send it out to the lab to see if there are any presence of the HPV virus, which can lead to cancer. So usually around age 30 or older, women should have regular pap exams to detect vaginal and cervical changes. A few types of genital HPV have been linked to cervical cancers. So that's why we have to do all these screening tests to see if we are at risk of cancers. Medications. So there are medications over the counter that are used for warts, but it's never to be used for genital warts. So never use over the counter wart removers for genital warts. If you find that you have genital warts, go and see your doctor, and they will give you either topical antiviral treatment, or they can do it surgically, or surgical option is usually by freezing or laser therapy, or like cauterize the area. So these are some of the options for treatment, and it's never to be treated at home. Speak to your doctor if you have any of these signs and symptoms of genital warts, and if you have any concerns or questions, speak to your doctor. So there you go, guys. We have just reviewed genital warts. This is just for informational purposes. So remember to speak to your doctor and continue to stay tuned to my channel. If you want to see more videos like this, remember to comment and subscribe. And if you want me to talk about the HPV treatment, you can put it in the comment section below. But there is a routine vaccine, so I can review the vaccine if you want me to talk about that somewhere. So that's it, guys. Have a good day. Bye.